Okay, hi everyone. This is Allie Morrison, and you're back for session number 2 of foam roller and ball therapy. So if you're watching this video tonight, for those of you who signed up for the series, I just want to tell you that is because I am I'm unable to broadcast tonight, and I anticipated this happening. So I just recorded this session for you just a couple of days ago. So this is all brand new material. It is a part of the series. And the bonus is going to be that now you're going to have access to this one class, which will be the only one in the class that will be recorded out of the whole series. So that being said, for a couple of you who are joining the series late, here's the things that you're going to need. You're going to need a foam roller, and you're going to need a blanket or a towel, whatever you have at home. And then you're going to need some type of therapy ball. I'm using a lacrosse ball. You could use a tennis ball, but you're going to need that for our practice tonight. And then just as a reminder for everyone, when you're using your foam roller, there are different densities of foam roller on the market today. They have soft, medium, and firm density foam. I really like to use a soft density, but for those of you who just have a hard density foam roller, I just want to let you know about this little trick where you can take a blanket, you can take a towel, come to your foam roller, and for some of the moves and positions that we do tonight, this is going to feel really good. All you're going to do is drape something soft on top of your roller. Okay, now it's going to make the diameter of your roller bigger, which in some cases can actually increase the stretch. However, the softness of the towel or the blanket is just going to make it like a little bit more palatable and receivable for your body. Okay, everyone. So this is a 45-minute foam roller class, and we're going to get started in our centering and breath position. So bring your roller into a position where you can take a seat on one end. And last week when we did this exercise, we oriented ourselves so that once we were on the roller, we had our head on the roller. Okay, so let's say you've got a really short roller and it won't hold your entire torso. What you're going to do is this week instead, you're going to slide forward. You're going to bring your buttocks off so that your roller end winds up touching the back of your sacrum. And then you can recline onto your roller, like so. And I'll show you in contrast last week what we did for those of you who had a short foam roller is I had you on seated on the roller, and then when you reclined, we did cranial base. So edge of the cranium hanging off the roller. So if you did this position last week, and you're one of those people who has a short foam roller, then I want you to try the second position this week, which is sitting off, okay? And for those of you who have an extra long roller like I do, please begin with your entire spine on the roller. Your knees are bent, your feet are flat on the floor, head is rested, arms are off to the side, palms are facing upward. Close your eyes and just very gently, with a micro movement, rock your spine a little right and a little left, finding that balance point and getting comfortable. Give the weight of your body over to the foam roller. Take in a full deep breath. And with the exhale that follows, relax your skeleton. Relax the density of the skeleton. Relax the soft and suppleness of your muscle tissue downwards onto the roll. Now deepen your breath so that you have a noticeable movement in your lower belly while you're breathing. Upper or middle belly as you think of it as you're breathing, all the way to the chest or the top of the collarbones as you're breathing. And the order of this movement of the breath is to inhale into lower belly, inhale into upper belly second, inhale into chest or collarbones third, and the exhale happens in the same order. Exhale from belly first, exhale from upper belly second, releasing the breath from the chest third. Now, this is recognized as a diaphragmatic breathing pattern. And if you're unable to find it, if you're unable to feel it, it's usually just an indicator of levels of stress in the body that affect hormone levels and therefore affect your breath rhythm. So not to worry, it's an observance that you're making about your own breath. For 3 more deep breaths like this. If you can feel your low belly while you're breathing, then try to start to feel the small of your back as you're breathing. If you can feel your upper belly while you're breathing, try to feel the back of your lower ribs while you're breathing, where your floating ribs are. If you can feel that breath fully expanding all the way into the top of your rib cage, the clavicle, collarbone area, see if you can also feel a breath behind your back, between your shoulder blades. And so now begin to rock a little more. You can drop one knee in and then the other knee. Use your arms on the floor for balance, for leverage. Move one knee over to the side now. Try to keep from falling off your roll. But this is just an organic, slow movement. If you like, when your knees drop off to one side, your head can turn to the other side. So when you drop your knees over to the left, turn your head to the right. Don't lift the head, that's not necessary. You're just letting your head roll on your foam roller. And you're just taking a little bit of inventory here with regards to tightness in the neck, or perhaps tightness or stiffness in your hips, your lower back. No judgment. This is a time to take inventory and notice. Now, come back to center. Your arms are alongside of you. Palms are facing up, back of the hands on the floor. Okay, with the right arm, sweep the right arm up to the side. You're not going to be able to see it so much. I'll lift it here so you can see it in the camera frame. But if you can, you could reach your fingertips back to the floor. Then sweep your arm alongside of you again. Now with the left arm, you'll see this more readily. I'm going to sweep the left arm up and perhaps bring it all the way up around by the ear canal, arm coming alongside the head, and then slowly sweeping the arm back alongside the hips. So this is going to be our slow movement. When you stretch your right arm up and you bring it all the way up, bringing it by the ear, this is where the inhale happens. And then exhale, right arm back alongside your hips. Let's see if you can sweep the back of the hand along the floor. Inhale, left arm up. Exhale, left arm sweeps back by the hips. Continue this movement. Inhale, right arm. And exhale. Second side, inhale, left arm. And exhale, left arm. Continue this motion. Inhale, right arm. Exhale, right arm down. Last one. Inhale, left arm. And exhale, left arm. Okay, much more slowly. Both hands at the same time. Bring the arms out to 9 o'clock and 3 o'clock and pause. We want to release the chest here. We want to allow there to be a broadening sensation happening across the chest, perhaps into the front of the arms where your deltoids are. If you're feeling that here at 9 o'clock and 3 o'clock, great. Otherwise, you can bring your arms up to a 10 and 2. Back of the head is on the block or on your roll. This is probably a place where everyone's going to feel some kind of stretch. Here at this 10 and 2. If you were feeling a really nice stretch at 9 and 3, just stay there. If you prefer to have it down around 4 o'clock and 8 o'clock, then just be at 4 and 8. Close your eyes. Backs of the hands heavy and rested. Perhaps the elbows also start to relax. As you continue to breathe deeply using this diaphragmatic breath that you established, then you may notice micro movements happening as the chest is releasing, the arms are recalibrating their alignment, the head may make micro movements. Really soften the tissue on the top of your rib cage. There is a notoriously tight area that is in the chest, and yet it's below the level of your collarbones. This is a challenging area to get into with stretching. But it's also an area that responds to a strengthening in the upper back. So if you like, squeeze your scapula back like you were squeezing your foam roller. And this may actually increase the stretch sensation. You may notice little tingly sensations going down into your hands or your fingertips. This is normal. This is an indicator that you are stretching into the fascial barrier, that place where the tension in the muscle, the tension in the system of the fascia is pressing against some sort of circulatory structure, whether it's nerve or blood, a pathway of circulation that moves from the central part of the body and moves outwards towards the extremities. Let's notice the sensation. See if you can just kind of monitor watching the sensation. Often with time, with patience, with deep breathing. These sensations start to diminish as the tension around that circulatory structure actually begins to dissolve, it begins to resolve its old tension, and it begins to soften, it begins to warm, and the muscle fibers begin to lengthen. Now, bring your arms into that 9 o'clock and 3 o'clock sensation. You're going to bend your elbows. Now you can start with fingertips up like I am, so you can see the direction. And then perhaps you can drop the back of your hands to the floor. You stay there. I'm going to come up to a seated position so you can see what I'm talking about. We call this Cactus Arms. And it's this position like a saguaro cactus where your elbows are bent in a 90-degree situation, and then you've got the back of the hands on the floor. So that's going to bring you into that external rotation at your humerus head. And this is going to be a place where I anticipate many of you are going to have a difficult time. It's like your hands are just kind of floating in space. All right, and if they're really floating in space, you can place a support. You can put a pillow underneath the hand. You may find by lifting and then bringing the scapula into more external rotation with the bottom tips of your scapula pushing in to the middle part of your rib cage, you may find you can get a few degrees of improvement in your range of motion. Okay, now if that's the case, that you're not able to get your hands back to the floor, just return to that straight-armed 10 and 2 or straight-armed 9 and 3 position. And you're here for 3 more breaths. Really make these breaths count nice and deep. And then slowly sweep your arms back by your hips. And then you can slowly press up so you come into a seated position. And we are going to come up to standing. You're going to need your therapy ball for this next position. So I'm using a lacrosse ball tonight. And we're going to come up to standing. I'm wearing socks. It's a little bit chilly. And you can wear socks or be barefoot. Okay. Place your therapy ball on the ground. And you're going to place the ball of your foot, the very center of the ball of your foot, onto the therapy ball. So I think you can see me here. Let's see, take the sock off. Perhaps you can see my skin a little bit better. Okay, so I got the ball right in the dead center of the ball of the front of the arch. And so you're going to just slowly go from right to left. I'll turn in this orientation, dropping the big toe side of my foot down towards the mat, coming up, and then dropping the baby toe side of my foot down. If you feel a little unsteady here, you can use your foam roller, like a steadying device, or you can place a hand on the counter, use a chair if you like. And you want to lean forward enough that you've got enough weight in there to start to feel a stretch happening. So a little back and forth, a little back and forth. The heel remains planted. This is going to start to really stretch out the sole of the foot. It can activate a lot of powerful points on the sole of the foot. You've got somewhere between, it's like 24, I think it's 24 bones in each foot. That's a lot. It adds up. You've got muscles in there as well, and then connective tissue, basically weaving and knitting it all together. Okay, So we're going to find a pause point here. You're going to take the baby toe part of your foot over, and you're going to pause here so that you're really getting a good stretch. It probably comes up into the peroneals here on the outer part of the calf. If you're slipping and the ball is squirting out, then I do recommend, take your socks off, and bare skin on the ball will often help. And sometimes with a tennis ball, I found, like, especially if it's a brand new tennis ball and the felt is brand new on the tennis ball, it's a little slip. There's some slip to it. So what you can do is something similar what we did with the blanket and the foam roller, where you just draped the blanket over the foam roller. You can take your blanket or your towel, drape it over the ball, and then sometimes that can add a little bit of friction in there. All right, lift up, take it over side 2. See if you can drop big toe side. Now you can tell I'm really internally rotating with this hip as well. Like, you get this weird look to my knee here. So be careful with your knee. Take the movement into the pelvis as needed, but see if you can get that mound of the ball of the foot. It's right underneath your baby toe. See if you can get that part of the foot to stretch. You've got 3 main arches in your foot. You've got your medial arch, which we just worked. You have your lateral arch, which we're addressing now. And then you have your transverse arch. And each one of these has a very different degree of elliptical curve to it. And so we want to address all parts to it. All right, now come back to center. And you're going to slide your foot forward. So now you're about at the middle part of the arch. I got my heel off the floor, and I'm just leaning to press into it. If you're like, wow, that is super intense, put your heel on the floor. But I don't want you to be on the ball of the foot anymore. I want you to come back so that you're about center or forward on the arch of the foot. One of the things you'll start to feel, and you're addressing fascia and deeper layers, is that even though the compressive part is on the sole of the foot, you feel this odd stretch happening on the top of the foot. This is a good thing. So the bones of the foot come all the way up to the base of the shin where the ankle is. And what we're trying to do right now, as you can see what I'm doing with my hands here, is you're trying to fan out those bones in the foot. So as we get older and we wear shoes, and watch what my hand is doing, see how the bones of the foot, they just start to creep, come together and come together. This can start to pinch on the plantar nerve. And it's the cause of neuroma, and it's the part of what I see when people have plantar fasciitis, and all kinds of things. So we are intentionally trying to stretch out the bones of the foot. Okay, come on up. You're going to slide it now. Check it out. It's kind of like having a high heel. I've got the ball on the back of the arch. It's not on the heel, it's on the back of the arch. I have the ball of the foot on the floor, and I'm just going to go for as much pressure as I possibly can here. And that's just because this is what feels good to me. Now for you, if you're new to this work and you haven't done it before, you're going to find a lot of sensitivity in there. So go for less pressure. You don't have to use your hand to press it down. So we're being patient here. I'm watching the clock. We're going for several minutes here, so we can really get into the deeper parts of the tissue. And you might be surprised. You feel it coming up into the calf. Really normal. Doesn't mean you're on a nerve. In a lot of ways, it means you're into shared muscle and connective tissue that blends the sole of your foot with the calf. All of this is woven together. To the outside, it just looks like separate compartmentalized parts of the body, but on the inside, it couldn't be anything more different. It's all woven in together. All right, everybody, roll it back, drop the heel down, lean forward. You may feel a stretch in your calf here, if you can straighten the leg. And then lift up and stand on that foot. And boy, is it going to feel differently than the one you haven't done yet. All right, let's do side 2. So start with your second foot. Again, it doesn't matter which one you do. And we're starting on the ball of the foot, pretty much on the arch there towards the ball of the foot. Now, it's nice to start by bending your knee and just kind of pressing, feeling into it. One interesting thing that I have learned is this begins to stimulate what they call in Chinese medicine the kidney 1 point. Well, the kidney 1 point is on the sole of the foot, and in Chinese medicine, it's recognized as the bubbling spring, the wellspring of life and energy in the body. And so this starts to stimulate that point. All right, so let's start to roll. You're going to go towards the baby toe side of your foot. You're going to go towards the big toe side of your foot. There's the big toe side of the foot. So just back and forth. This is your transverse arch. It connects the big toe side of the ball of your foot to the baby toe side of the ball of your foot. So here it is, back and forth. Sometimes this is a little surprising. Sometimes you can feel really sore areas in there. One of the things I find interesting about this wellspring point, this Chinese point, is when you think about, say, like a 3-year-old, watching a 3-year-old walk or run, they almost always do it on their toes. They're on their balls of their feet. They're full of life. Okay, and then the older we get, you start to, if you think about maybe the oldest person that you know, in a lot of ways, when we watch our elderly walk, there tends to be a shuffle. They tend to walk on their heels and they tend to shuffle. So we kind of move, through the spectrum of life. We kind of start on the balls of the feet, everything's enthusiastic. And then as time goes on, life takes its toll. We have a lot of injuries. We kind of slow ourselves down to a shuffle or to a heel heavy gait. So this starts to awaken the foot. So we go back to that more youthful way of using the foot. Okay, so moving on. Come to the middle of the foot. I'm going to back up a little bit here. Maybe the heel is lifted. Maybe you can just lean forward. Right on the center of the arch, just behind the ball of the foot. This can be really, really tender here. If you can take it and you want to have your heel down and you want to go for more pressure, then you can lean. This is really getting into the plantar muscle, right on the sole of the foot. And this is the one where you may notice this odd skin pulling. It really feels like skin pulling right across the top of the foot, right across the bridge. So make adjustments as you need to. Press into it. And then you'll lift the heel up, come forward. All right, ball of the foot down, heel is lifted. Notice how I don't have the ball on my heel. I want you to come back so that you maintain awareness of the arch. Maybe it's a little bit on the heel, but it's mostly on the back part of the arch. And then see if you can press again. Your feet are so tough. They withstand all kinds of forces all day long. And you can be surprised how much pressure they can take. Now, you got to back off of the sensitivity, because if you find yourself holding your breath, That's going to be counterproductive if you find yourself gritting your teeth, you know, if we're releasing tension in one area, creating tension in the other area. It brings us into net gain. So let's avoid that. All right, everyone, roll it all the way back, ball the foot down, heel down. See if you can straighten your leg. Lean forward so you get a little bit of a calf stretch. And then carefully release. Okay. Stand on both feet. They should feel absolutely fantastic. Hold on to your roll. I'm going to turn to the side here. This stretched out feet really helps you find a good standing posture. Your roll is going to go about where your sacrum is. Your sacrum is this big bone at the base of your spine. So you're going to bring your hands around. I'll turn so you can see. I've got my palms facing towards the front plane of my body. And I've got my kind of my forearms, elbows. So this is one to release the lower back. This one feels really good. You're going to start with your feet about hip distance apart. So if you look at the center of my ankles and you look about where the center of my hip joints are, that's about hip distance apart. This is going to be more outer hip distance apart. So start with them about hip distance apart unless you need wider for balance. All right, lift your sternum right in the center of the chest. Press your feet down. And now just move towards the ball of the foot and the heel so you can feel the relationship of your pelvis to your feet. When you come forward towards the balls of your feet, can you lift up on your kneecaps? And then when you come back to your heels, can you feel where your hamstrings are working? So pelvis forward, and then lift the chest and lean back just in small amounts. Don't allow the hips to move back. See if you can move the hips forward. Lift up through the sternum. Careful about being back on the heels. We just really opened up the feet, so you want to be forward on the balls of the feet. Now, the minute you start to feel any strain in your lower back, then you want to lift up just a little bit. Okay, but as long as you're feeling a good stretch, I want you to squeeze your buttocks. This is going to make the pelvis a little bit stronger. Now, some of you are actually going to be able to reach behind you and lace your fingers together. Now, look how low my roll is. All right, it's not up here on my lower back. It's down here on the sacrum. So I'm pushing the coccyx, the very tip of the sacrum, pushing that forward. I can feel the balls of my feet. I'm coming to tolerance. I'm coming to a place that feels good for me. And I'm going to hang out here. And when the legs or the muscles around the back or your abdomen start to feel like they're starting to fatigue, I want you to squeeze your buttocks and straighten your legs. Keep your chin down towards the shelf of the chest. Lift your sternum towards your chin and just keep your eyes level, gaze looking forward. You're here for 3 more breaths. This is opening up the whole front body. And just an interesting point to note, this opens up the digestive tract as well. Stomach, large and small intestine, hip flexors. Okay, now to come out of this, push down onto your feet, lift up through your sternum. Inhale, come all the way up. You're going to swing your roll around to the front and bend your knees, and you're going to get your lower part of your ribs down onto the roll. So it's going to look something like this. Lower part of the ribs down onto the roll. And what can happen there is you start to get a release into your diaphragm. Maybe your hands can come to the floor. Maybe perhaps you need support for your hands. That could be possible. You can use a water bottle. Maybe perhaps you can slide the roll in a little closer to the creases of your hips. That feels good. If your hands can come to the floor, perhaps you find a way to straighten your legs. Drop your head. Let your head hang in traction. With micro movements, let's begin to circle the head. Maybe you look left and right. Maybe you make a figure 8 type of a motion with the crown of your head. Maybe you can lean back onto the heels or lean forward towards the balls of the feet. And again, you can always bend the knees. Now, for those of you, you're born to forward fold, this comes to you easily. I want you to bring your hands to the base of your skull. Bring your fingertips around to where the V-notch is at the back of the head. Press your fingertips into this spot. If possible, you can bring your thumbs out to the right and the left of this little V notch, and then begin to press your thumbs into this entire area at the base of the skull. You're tracing this bony ridge. This can be a place of headaches, but this can be a really good place to release the sacrum and to release the backs of the legs. These are powerful healing points within trigger point medicine, within Chinese medicine. Now place your fingertips down and halfway lift, everyone. I hope you're enjoying this class so far. Okay. Now to come up to standing, you bring your hands under your roll, bend your knees, inhale to come up. All right, here's our next one. Coming back down to the floor. Okay. This one's going to be for outer hips. We're going to be doing, you can tell already, this class is different than what we covered last week. So we've got a lot of material to cover through each one of the weeks. And so we're doing little bits as we go along. Okay, so you're going to start with your roll alongside. It's just like the length of your thigh. And one of the things we did last week that was really cool was we took a look at, I mentioned the outer part of your hip, and we identified on our bodies where these bony landmarks are. So let's just do a little review. If you have your hand on your hips, just like this, technically your hands are on your pelvis. Okay, if you have your hands on your hips, technically you'd have them down here. Okay, so hands here on the pelvis. There's another bony prominence down here. This one's called the greater trochanter, and this is a bony prominence of your femur, which is your thigh bone. So this bone is your thigh bone. This bone is your pelvis. This bone is your waistline. This bone here indicates your hip joint. So from this bony prominence, if you go directly in, parallel to the floor, this is where your hip joint is. So it's a lot lower. So you can see, this isn't really hands on the hips. This is hands on the hips, but that's just what we call it. So this is really hands on the waistline. So we know these two bony prominences, and your roll is going to go somewhere in between there. And we worked on that last week. Okay, so this week, I'm going to come on to what we call the side of the hip. Okay, I've got my elbow down, and I think I'm just going to make a little camera adjustment here so this is a little easier to see here. All right. All right, coming on to the side of the hip. Come on down to your elbow. Your top leg can reach forward. Your bottom leg can either be straight or knee bent. Okay, so we're starting with, this might be one of the few times that we're actually rolling. So if you've got one of those really hard foam rollers, boy, can you feel it. If you've got one of the soft ones like what I have, it's really, actually, it's less noticeable. So we're going to do a combination of this, which is rolling, right? Bottom leg could be straight. Front leg is bent. Okay, so here we are with the rolling, and now we're going to do a little bit of rocking. So you're going to lean back and roll forward. Lean back and roll forward. Lean back and roll forward, and then come back and do a little more rolling again. Now, if this feels really good and you're wanting a little bit more, one of the things you can do is just come down on the outer hip. This is one of the ones that we did last week, but we did the side lying position, not this bent leg position. And so you can do a little bit of rolling here. This may feel good, or you can do a little rocking and lean back. Or perhaps rock forward. So depending on the role that you have, see, everybody in the class is different. And then depending on your body, you can do this rocking and rolling on the outer hip from this lifted position on your forearm, right, rocking, or reclining down onto your bottom shoulder, rocking and rolling. So this one is truly for the bottom hip, the tissue that's on the outer hip, on that bottom side. All right, everybody, we've got a few minutes left in class, so we're going to switch sides here. Come on up. We're going to do side 2. Just have yourself oriented so that you can see the screen. Top leg is bent, it steps forward. Bottom leg is bent. And we're going to start with this outer hip rolling. Now this is, again, I talked about it last week, but the tensor fascia lata, this big weird muscle, it's about the size of your fist. It's right there in the area we're talking about. That's the one that becomes your IT band, which is a tendon. So the muscle has a tendon. The tendon connects the muscle to the bone, but this tendon is so long, it has its own name. Everybody knows it's the IT band. So we're working on the muscle that becomes the tendon. And this muscle is going to be much more elastic. It's going to be much more responsive than the tendon. Tendons are designed to have a little more collagen in them, if you will. The muscle belly is going to have a little more elastin, so it's going to be a little more responsive. Okay, so you can rock. We just did the rolling. You can do some rocking. Or if you're feeling good already and you want to lie down, you can do some rolling like this. This is feeling pretty good. It may be that you're feeling like the rocking and the rolling is good, but that being still in a static position feels even better for you. I got some emails from some of you this week that commented on less rolling and more static holding was what gave you those flexibility and tension relief benefits that you're looking for. So just move back and forth here. Like I mentioned last week, it's that very crucial element of time. It's a duration of time that you spend doing this work. It's probably going to serve you more than the, the intensity, the discomfort. So keep that in mind. Without getting into a lot of theory about how fascia releases, let your own experience in your own body, and you just test this approach out on your body, and you let your body be the judge. It'll let you know. So this is more of a deep tissue massage, compressive massage technique here. It's designed to warm tissue. And then when you come into that static hold, this is where you start to address that internal web of fascia. And both are important to get good release and improve range of motion and have a little more freedom in the body. All right, so come on up. Come on up to a seated position. And that was our session for tonight. A lot of lower body, and we'll be adding on to this next week. We'll get into some more upper body with the chest. I'm going to show you how to use both the ball and the foam roller to get into some parts of the upper body that might be, eluding you with other techniques. So, thanks everyone for coming tonight. You are welcome to send me an email if you have any comments about the material we covered in tonight's class. And you're welcome to save and return to this class at any time. Thanks everyone, and have a great night.